Thank you, everybody, for coming to the Awake and Thriving podcast. Today, I have with us Dr. Karen Jones. She is a retired OBGYN, energy healer, and transformational facilitator. Welcome, Dr. Jones.
Oh, thank you. And call me Karen. That is perfect. That is perfect.
All right,
Such a pleasure.
thank you. I wanted to talk to you a little bit about just your journey, how you got from OBGYN to energy healer and transformational facilitator. That's an amazing journey that I would love to hear more about.
Oh, I would love to share that. So it's actually kind of funny how I ended up in medicine to begin with, because going through high school, I was good in math, I was good in science, and I was shy. And I kind of initially thought, oh, maybe engineering. So my first year of college, I did this orientation to engineering course taught by a mechanical engineer. And I can tell you, after a couple of months of I-beams and that kind of thing, I pretty much backed off and said, I have got to do something that works with people. So then, of course, me being me, I was thinking, well, okay, I could go into medicine. I kind of naturally will just pick what's the hardest thing I can do. It's really funny how I do that. So I thought, oh yeah, medicine, doctoring, that sounds like fun. And then I'm, getting ready to say, well, what am I going to major in? Well, and at that time, because this was a while ago, people were majoring in pre-med. And I kind of thought, pre-med, that seems so bogus. Let me major in something more interesting, because like maybe I don't want to go into medicine. So let's see, what would be nice and difficult? Oh, how about biochemistry, biophysics? So I know you just got to laugh at me. I laugh at me too, because it is really funny to look back on. So I got my biochemistry, biophysics degree, went on into medical school, Oregon Health Sciences University, which was great. I loved it there. And then here I am trying to figure out what specialty I wanted to do. And my initial thought was, again, remember, this is back in the 1980s, and women in medicine were very typically going into pediatrics and family practice. And I'm going, I don't want to, and at that time, looking back, it was clear I was doing the, oh, women only go into thing. Yeah. We were still working on ourselves at that point, let me say. But what I realized what I really enjoyed doing was things with my hands and things with my head. And so it was like, well, there's urology and there's obstetrics and gynecology. I think I want to work with women. So, yeah, exactly. So then I went into obstetrics and gynecology and did my residency, and then came out to Seattle and practiced in Seattle for many years.
Oh, and then what brought you towards energy healing? Like, how did you stumble across that being an OBGYN?
Right. So this is in the 1990s, and I was starting, this is when body medicine was really starting to come into play. So I was reading things like Joan Borisenko and Carolyn Mace, enjoying that. And I also started, so I got a sense then of what obstetrics and gynecology really has a lot of second chakra organs. That's the uterus, tubes, and ovaries. Okay. And what the second chakra emotional development things are, which is really your one-on-one relationships, your creativity, how you orient with the employees and employer sort of things. And I began to notice, I had this one particular patient, I still remember her. She came to me one year and she had a problem. I think it may have been an ovarian cyst. And the next year she came to me and I think we had a discussion about fibroids. And then she saw me again a year later and she had an abnormal pap smear. And at this point I'd done enough stuff that I'm realizing, wait a minute, she's having all these health problems and second chakra issues.
Yeah.
So I asked her, have you had any issues with your creativity, with your one-on-one relationship with your partner, with maybe your employer? And she goes, yeah, all of that. And I'm going, bingo. look, we're having some issues with your second chakra, physical, psychological issues. You need to begin to work with this. And that really, for me, showed me there's this relationship between these different areas in our body, between the psychological issues that go on. And all of that put together made me start thinking there's got to be, it's really more interesting to discover what is helping us to be healthy as opposed to what's making us sick. So I began to think more along those directions and more along chakras and energy and all of that. And then I started getting tingling in the palms of my hands. So I was going, what is this? This is 1999. What is this? I don't know. So I'm at a Carolyn May seminar, and I just happened to mention to this woman in the lunch line, I'm getting tingling in the palms of my hands. And she said, must be energy. Why don't you look up healing touch? So I get home and get on my computer, and there really is such a thing called healing touch, many if you know that. So I go on to get on healing touch. I never found healing touch, but I found the Barbara Brennan School of Healing in about 2 or 3 links. And I looked at it and I'm going, oh, energy healing. And it does all of this personal growth, personal process work that I'd never done before in my life. And that really was what made me say, oh, something inside said, yes. Even though mentally, logically, I'm going, well, I should probably do a weekend seminar, make sure it's really what I want, the logical part of it. And the inside is going, yes, go now.
Yeah. And what was it? So what was the turning point? Was it was that program itself that helped you turn, right? And you're like, this is where I need to go and start implementing this with my patients? Or did you actually implement that with your patients? Were they open to that? Or how did you blend those two? Or was that not till later on?
Yeah, I did. Well, I did. I would say going to the Barbara Brennan School of Healing was a huge turning point in my life because I didn't realize it, but I was living all in my head. I wasn't living in my body. I was nice all the time. People would say, oh, Karen, you never get angry, the whole blah, blah, blah. But really the truth was I didn't know how to deal with uncomfortable emotions. And so I wasn't. And so I go to energy healing school, and my strengths of logic in my mind became my weaknesses because I had to learn how to get in my body, get in my emotions, and begin to balance kind of mind, emotions, will, mind and body, all of that together. And then I could start bringing that to my patients more because as I was more in touch with myself, I could be even better connected with my patients. I mean, I was always really good with my patients, but I became way better. And for those who were interested, I could start saying, okay, here you have this particular issue going on. Let's speak to what's going on medically. But for people who are interested, let's speak to other ways of other perspectives of viewing this. You have fibroids. Well, fibroids in alternative medicine is block creativity. So for those who are interested, let's speak to where in your life are you blocking your creativity? Because the problem is if I just heal or deal with the physical problem, if I haven't dealt with the underlying emotional, psychological issues, it's just going to come back in another form. Yeah. And to me, being let's be efficient and effective, it's like, no. We're not going there. I don't want to waste it. I don't want to waste your time.
And how were your colleagues in OBGYN with this, with the implementing energy healing and chakras into medicine?
Well, so I was I had a couple things going for me. I'd been in practice a number of years at that point, and I was still in practice. I was also the senior member in my group, so I had some credibility.
Yeah.
there, which was good. And I have to admit, I was pretty shy about it and I didn't speak a lot about it.
Mm.
Um, but, you know, at the same time, I wasn't necessarily hiding it. So I just didn't speak a lot about it. So people kind of knew that I was doing something.
Okay.
Uh, and that was good.
And then how does the transformational facilitator um, interact with an energy healing? I've I've actually I've never heard of a transformational facilitator. Can you tell us more about that?
Sure. Well, that actually came into being here real recently.
Okay.
So I got to the point in medicine. Well, actually, can I make a comment because you'd asked about how I integrated
Yes,
energy
absolutely. Go
healing
for it.
in that? Okay. So basically what I did is my medicine, my medical knowledge kind of was underpinning my energy work because I had a small separate energy healing practice. And
Mm.
my energy healing kind of underpinned my medical work. So I would do things like if I'm with a woman who's in labor, you know, you're there in and out of the room for a long time. I would take a few moments during her labor and just intentionally set my intention for the highest good for this woman, for this baby, for all the people here in this room.
Mm.
And I would do the same thing when I would go in and do surgery. So
Oh.
I'd have a woman I'd be taking to surgery, open surgery, laparoscopic surgery, whatever we happen to be doing. And the same thing, I would set the intention in the room to hold the space in the room for the, you know, the highest and greatest good to happen.
Mm.
And for me, that kept me, I think, really focused on doing my best on as many levels of the field as I could and supporting her and supporting all the people in the room. Because, you know, there's my partner who's there, there's the anesthesia doctor, there's a scrub nurse, there's the circulators. You know, everybody, we really want to support everybody to be on the same page in the same wavelength, both overtly with what we're talking about, so we're all doing the same thing, but also covertly with you know, the energetic thing. So I use that. But I did have, because I was in a group practice and in a large multi-specialty group, I didn't do energy healing per se in my medical practice. It was separate.
It was separate. Okay,
Yeah.
perfect. And
But then I
so
got, yeah, go ahead.
go on.
So I was saying then the last few years I worked, I got to the point where I, you know, that feeling that comes up where you just sort of say, I love what I'm doing and I don't like it as much as I need to anymore. And that came more and more till finally I said, okay, I need to retire. So I retired 4 years ago and I knew I wanted to do something. I love to teach. I love this whole energy medicine thing, but I wasn't quite sure what I was going to do.
Mhm.
And so I tried several different things. And then I ran into uh, a woman with a group. Her name is Dr. Claire Zamet, and
Mm.
her group is Evolving Wisdom. And she teaches basically feminine power system principles and how to pull that into our lives, which is really incredible. But one of the things they teach then is a professional program of, transformational coaching, transformational facilitation, and transformational leadership. And
Mm.
I'm doing the facilitation thing because I was really wanting to shift toward how to help groups of women
Mhm.
with doing a workshop in a way that's going to result in some kind of transformation, because
Mhm.
too many times we go to workshops or we read a book,
Mhm.
it's great, but we don't really figure out how to apply it to our lives
Yeah,
in a way that actually causes change.
yeah,
And
yeah,
that's what I'm all about, is really, you know, it's really take what you desire in our lives and here's some principles and practices to use. And so with facilitation, you know, there's particular ways you can help people to say, okay, what does this mean for you?
yeah,
And now what's the inspired action?
yeah, yeah.
And how can we be accountable? Yeah.
And
So that's how I got into that.
so to when you're a transformational facilitator, is that so that's it's teaching and their workshops, how okay, so let me backtrack. So I'm coming to you for a facilitator, right? So I would encounter you at a workshop, or do you do one-on-one sessions as well?
So I do one-on-one sessions. I have a 6-month mentorship program where I guide a woman through these, using the transformational principles to help her basically take where she is in her life, which may be, often what I say is I'm taking women who are already succeeding or successful, but inside they're going, I'm not happy, I'm dissatisfied, I'm discontent, there's something more, and I don't know what the heck it is. So
Yeah.
kind of like where I was,
Yeah.
and help them go through the practices of embodiment and awareness to begin to bring in, go deep and bring in, what do I really want to be?
Mm,
What is the experience I want to create in my life?
okay.
And then bring that into being. But I'm also going to start doing workshops where I'll do that same sort of thing. And ultimately, I'd like to have a small group where I take people through 6 or 9 months of in a small group process, because it's really fun to do this with other women
Yeah.
who are in their own way having their struggles, and we can learn so much from each other. We
Yeah,
really can.
definitely. And so you do, what area are you at? You're up in the Pacific Northwest.
I am. I'm in Seattle area.
I love Seattle. It's like one of my favorite cities.
It's wonderful.
So, okay. So you do the workshops up there and you do one-on-ones. So say I was going to come to you for facilitator or even as at a workshop, what would I expect to experience first with you?
Right. So the workshops, obviously right now they're all online,
Yeah.
which is totally fine. It's basically, I mean, the first part of it is for me being present with you, with the women that are there, and that's something I've been able to do all my life is create a feeling of safety,
Yeah.
so you can be in a place where you feel like you're in a safe container. And it's really common for women I'm with to even start feeling emotional, feeling some of that, and speak to some of this emotional pain that they've had, that they maybe never have spoken about to other people,
Okay.
to be able to speak to what's really going on. And so that's where we start, what's really going on here. And then I like to work with what are the beliefs, what are the stories, what are the patterns? Because often what we have as women inside us, if we have a feeling of I'm not good enough, that shame, that disconnect with my resourceful self. So helping women get into contact with that again. And often this is what I call, or what is called, not I call, but it's the 3 major barriers that women have. That's the first one, is disconnection from themselves because they feel there's something wrong. I'm not good enough. I'm a failure. The second disconnection is when you feel like I'm not connected with something bigger than myself. So whether you call that life or the universe, or there's the knowingness that there's something in life that I'm co-creating with life with a capital L.
Yeah.
Because if I know that, there's a feeling of, empowerment that goes on there. And then the third barrier that women have, particularly, is feeling isolated. We are just learning as women to collaborate and co-create with the women and the resources around us. Too much of the time we think, I have to do this myself.
Yeah.
That if I need help, I'm weak and I'm not doing it right. So I'm supposed to do it myself. And that is another huge thing. I mean, it was really interesting for me personally as I reflected and came up with what I was telling myself, when it would have been made the most sense to go in and get some help and support on skills and all that kind of stuff. And what I was telling myself, the reasons why not to do it, it wouldn't even come to mind. I mean, isn't that funny? Isn't that funny? Or I'm weak to need help, or I'm a strong woman, I can do this all myself. And yes, it's true, but that I have to do it all myself is not the correct
No.
assessment that we do. And yet we do it all the time. And then we see each other as competition instead of collaborators, coming directly from that belief in lack. There's not enough clients, there's not enough money, there's not enough resources to go around. Then, of course, everybody I see is a competitor instead of, wait a minute, there is more than enough, and we're collaborating. And isn't this wonderful?
Yeah. I encountered that with one of my girlfriends, and when she said what she said to me, I was shocked by it because I had never viewed it that way. I was single before. I'm not single anymore, but I was on a dating app, and we've probably within about a block of each other. And I told her, I was like, you need to get on like a dating app. Like they're super fun. You just go out with guys, and a lot of them are like really nice guys. You just like go out and have fun and have dinner and like a drink. And she looked at me, she's like, you want me to get on a dating website? And I was like, well, yeah, why wouldn't I want you to get on a dating website? She's like, well, because we live so close together. And I was like, I I'm not, there's more than enough men. Like, I feel like there's like a ton of men out there. And I'm not afraid of having my friends who I think are amazing being on the same dating website as I am. But when she told me that, I was like, because I had never thought of that, because that's not how I think of dating or men in general. There's like plenty of men, just like there's plenty of clients. And I wasn't afraid of that. But that was my first encounter really with somebody, I guess, being honest enough with me and saying that, like, didn't I have like a scarcity mindset? And I'm like, no, I actually don't have that mindset. I have an abundance mindset. So as women coming together more to root each other on and lift each other up, I feel like a lot of us are coming out and doing that now, and it's beautiful.
I think so too. I totally agree. And I think we're really getting more and more to understand the saying, like a rising tide lifts all boats. As
Yeah.
I do better, I'm helping everyone else. As everyone else does better, you help me.
Yes.
And that's beautiful.
Yes.
It's beautiful.
Because they'll help people behind them and so forth, and it'll just have like a ripple effect. And I love that.
Right.
So
That is absolutely true, because you figure out, the people that are ahead of me are reaching back to
yeah.
help me,
Mhm.
help you. And then we can turn around and reach to those behind us and say, yeah, come on, the water's great.
Yeah, the
Come
way I
on in.
visualize it, this is my visualization for it, is that there's like people, like there's flowers above me that I'm encouraged by and inspired by. And then I have me, and I'm like kind of in the middle. And then I have flowers below me that like are just sprouting and that need like that encouragement and aren't quite there yet to go to the big flowers yet. So that's how, and like we just like help each other. Because I feel like men have been helping each other for a really long time, and we're barely getting on that bandwagon,
I
rooting
know.
each other on.
And I really like to speak to this because I think it's that sort of shadow sisterhood thing
Mhm.
that has certainly in the past was going on a lot. You'd hear stories about it. I mean, you'd hear stories about Hollywood where a big name actress would almost deliberately put down the rising star,
Mhm.
and the rising star would backstab the big name actor. And you're just kind of going, oh my gosh, this really happens.
Yeah.
We need to be aware, because the more we're aware of that, then we can notice when I mean, we're human. Tendencies like that are not resourceful are going to come up.
Yeah.
It's just being aware of them so we can say, oh, what was that? What just happened to me? What was behind that, ooh, I'm afraid thought
Yeah.
that just came up? Because then you can understand it, soothe it. I'm all about, when those fears, when that anger, when that emotional pain, that sadness comes up, it's not to push it away.
Mm.
It's to bring it close, hold it close, and understand it's a younger version of myself that was hurt, that's scared. And she doesn't need to be pushed away or pretend suppressed or repressed.
Yeah.
She needs to be soothed and then let her know, hey, here as the mature adult ego, I can tell you, you are safe.
Yeah.
I can tell you, you are enough.
Yeah.
I can tell you, your voice is here to be heard.
Yeah.
So speak it out.
Yeah, definitely. How do you, so now that you're like involved in this full time now, what are your old colleagues say? How do you envision this being integrated into Western medicine in the future?
That is a good question. So for me, I've always looked at, because I was, Western medicine, allopathic medicine, and then energy medicine, which in a way is sort of the far, far end of alternative medicines. I kind of bypassed all the other ones,
I
which is
interviewed
kind of
all
funny.
those at the middle, and I'm
I know.
going into energy because energy healing, I mean, let's be honest, Karen, there's some people that are afraid of acupuncturists still, let alone,
Exactly.
and that's at the very beginning. Insurance is covering that now, let alone going all the way down to energy healing. So it's when I was like, I have to do energy healing. It's part of the holistic realm. But I know that there's people that if they're not if they're not comfortable seeing an acupuncturist yet, when I'm talking to them about energy healing, they're gonna be like, "What is she talking about?" But it's a real
Right.
thing. Like I've actually done it before. I actually had an acupuncturist who did energy healing at the same time, which I thought was phenomenal. It's a great
Hmm.
combination.
Hmm. It's really cool. I mean, so I've taken it then because I've done this for many years. I would take it as a both and it's really important for us. Here's my Western medicine hat as physicians to be very clear. There are some things that Western medicine does phenomenally. If I break a leg and it needs to be set,
Yeah,
guess where I'm going?
yeah,
If I have a burst appendix,
yeah,
I'm going to get that dealt with. It's true. But we also need to be very clear that chronic illnesses, Western medicine doesn't handle as well. We're kind of playing this sort of supportive game and not always looking to see is there something underneath.
yeah,
It's so interesting to look at something like diabetes.
yeah,
And not that you don't need to be on the proper way of eating for that. That's really what you need to do. But the alternative way of looking at it is say, this is someone who's not taking in the sweetness of life.
mhm,
So let's reflect on this a little bit. Where are you not letting the sweetness of life come to you? Because maybe there's something there. And maybe what is between you and your self-care in terms of the most healthful eating, what's stopping you there, because there's beliefs there. It may be lack of education, it may be beliefs that's stopping the person with diabetes from eating as healthfully as they could.
yeah, yeah,
There's things like that. So there's a both and approach. So it really is going to behoove us, I think, more and more to kind of say, all right, what is really helping here? And let's look at it. Let's see if we can have a more holistic approach. What several different things can we use here
yeah,
that's going to help this person with this situation have the best outcome?
yeah, yeah,
So that's what I think is. And there's certainly more and more of that going on where you'll find hospitals or centers which are having energy healers. I mean, obviously, nutrition is very common now, but uh, um, people who do herbs and
mm,
acupuncture and all that to really say, okay, what's good? And there's more and more studies going on to say, okay, what's helping here? I
mm,
mean, it's fascinating that, for infertility, for instance,
mm,
that there is some types of acupuncture that actually help women get pregnant better. I mean, there's studies that show this now. So to have studies come out and really embrace it. So part of it is letting our dependence on old paradigms go. We really need to be a little bit more flexible
yeah,
and take a look at things.
yeah,
And I mean, pretty much anybody who says this is the only way to go, I pretty much am going, I don't think so. On
mhm.
any side, on any side.
Yeah, definitely. And that's how I feel about it because being in Western medicine for as long as I was in organ donation and neurosurgery,
Ooh,
seeing
ooh,
just the organs. Like, we're sick. Like, we are a sick society. It doesn't matter how Western medicine does help. Like if you need a surgery, a trauma, you've been in a car accident, you want a doctor, right? You want them to fix you up. But keeping you well, you need holistic for that side. And the people that I've talked to, especially in Western medicine, in the sector that I was in specifically, they were super sick. And they didn't, they thought that, or they think that holistic medicine is just like a phase. That it's just a phase right now. It's going to go away, and we're going to be back to like all of our medicines and drugs, and we're going to be like okay. And I was like, do you not see the organs that we get? Like they're terrible. There's 20-year-olds that have awful organs. Like that speaks to our society, that we are just on the verge of I guess enlightenment into the holistic side and really coming full circle. Because I feel if when we finally do embrace holistic medicine with Western, it's going to be beneficial for us all. But I think on Western side, I've talked to a number of physicians that are definitely opening up to great physicians that are like, yes. But then there's the other side of the spectrum, that there's physicians that are like, no. Like I literally worked with a physician once who called himself Hyperion. I don't know if you know who Hyperion is, but
Say that again. I don't remember. I'm not remembering.
He is the father of the gods. So he looked at himself like a god. He was a neurosurgeon. And those are the type of egos that are really happening in Western medicine. And that we're going to have to, it's going to take a few years, honestly, to phase that out. And there's always going to be people like that, unfortunately. But I think as more studies come along that show that, yeah, holistic health has a place and it's not going anywhere, it's actually going to get bigger. Amazing, amazing. I can't wait for my children to like really be in that society where they get access to like all these holistic practitioners versus just like, oh, you need to go get some medicine all the time, instead of going and trying to make yourself better before you're sick.
Right. And part of it too is with the patients is really, I think it's happening more and more this where people, because with holistic medicine, it really is encouraging self-responsibility of our patients or clients. You know, so if part of what's going on with my patient I spoke about way at the beginning, who was having abnormal pap of her cervix, was obviously it's a viral infection that I needed to deal with. We dealt with that.
Yeah.
But why that? Why then? Part of it was how she was blocking her own creativity. So she needed to also be self-responsible and say, okay, what do I need to do here? Do I need to get a mentor, a guide, a coach who's going to help do not just the mental, but also the emotional fears and stuff that were holding her back from her own creativity? Because when you have negative beliefs like I'm not good enough or I can't create, it's held in place by the emotion. So you can't just talk about it. You got to get down and feel the emotion and release that. So I digressed a bit, but it does come back to we all have to be self-responsible, because I certainly had enough patients who it wasn't quite give me a pill, doc, but basically it's like, oh, I'm not interested in the psychological, emotional aspects of that might be playing into this.
Yeah.
I just want you to do something about this ovarian cyst.
Yeah. And I think that's the holistic side that a lot of people, once they even try to dip their toe in, it's not an instant cure. You have to be responsible and you got to take certain actions in order to get that optimal health, versus if you go get a pill from a physician, a lot of times that'll help you within a day or two, but you'll have to up your dosage every few months or a few years, but it will. With holistic, you will have accountability to yourself to change habits.
Right. It's really true.
Yeah.
And there's more chance of finding things because it is really intriguing how many of the times that the problems people have can be helped with simply supplements. I mean, how many people where, depression is worsened by low magnesium levels, low serotonin levels, you
Yeah.
need vitamin D, so there's some things, some very simple things you can try.
Yeah, definitely. I've said this a few times. I just started taking mega doses of vitamin D probably about a month and a half ago, 2 months ago, because I don't like being in the sun. I always wear sunscreen. I think a lot of people do that now.
Yeah.
And so it's one pill a day, a week. And that one pill of vitamin D, because I take like primrose oil, just other supplements as well. But vitamin D, it really did have an effect that I could feel. Like I was like, oh, this is like one of the only supplements that I've actually feel a difference when I do take it versus when I don't. So that was pretty amazing for me. And then vitamin C, I know this is controversial. Some people are like, you can't take a certain amount of vitamin C because your body will pee it out. But I go up to that max daily, and it's actually been super helpful for my skin. It's good for your immunity. Okay, great. People slather vitamin C all over their skin, and I mean, it's okay, I suppose. But taking it orally has been more beneficial for my skin than it ever was slathering it on my skin. So I don't know, everything's different and it'll work for everyone differently. But for my body, the vitamin D and the mega doses of vitamin C I mean, those are the biggest changes that I've seen in myself. So
That is great.
yeah,
Yeah, and I totally agree with you. I think a lot of people are avoiding the sun because of the risk of skin cancer.
yeah,
But the problem is low vitamin D levels. I mean, vitamin D is a cofactor in many, many different, biochemical reactions in our body. So lack is a problem.
yeah,
So for people who are saying, gee, how do I up my immune system?
yeah,
Vitamin D is one of the obvious ones,
yeah, yeah,
you know.
definitely. So, all right, let's see. Gosh, what are some books you're reading right now that you would like to tell our listeners? Is there any books that are like interesting to you right now?
Interesting. Well, most of my books are like my fantasy and science fiction and mysteries. So that's what I like to do. Let me see. What have I read recently that I think is good? I still think if people are interested in the whole mind body connection, if you haven't read some of Carolyn Mace's books or Joan Borisenko's books, I think they are just classics and so easily readable. I remember Carolyn Mace's book. Um, how does she call it? How do you get? I forget. It's something like how you get sick and how you can heal or something like that. But it's great if for people who are just curious about the whole, what is this thing about chakras? What are the body structures and what are the emotional and
Yeah.
psychological aspects that go with each one? And it isn't always true that, gosh, if I have a third chakra organ issue, then the problem is with my third chakra. It doesn't necessarily work that way either. If my third chakra is the weak one, then that may be the area of the body where illness will come out, but
Mhm.
that may not be where the psychological component is. It's
Interesting.
a little complicated here. You can't necessarily say A equals B,
Yes, definitely.
but yeah.
So this will be a good one. This will be an easy one. So, what is your favorite thing to eat?
My favorite, besides chocolate.
Yes.
Yeah, because that's for many people, that's a favorite thing to eat. Okay, I have to say my favorite lunch right now is I steam broccoli and cauliflower,
Mhm.
put butter, a little olive oil, and part of an avocado on it, and a little sea salt.
Really?
It's really
Hmm.
yummy.
I like those vegetables, but I've never combined them. Actually, I don't think I've ever combined all those three vegetables together.
Well, what I like for me, I do better if I do a little higher on the fat, higher on the vegetables, and a little lower on the carbohydrates.
Mm,
So, okay, and higher on the protein too. But adding a little butter and a little olive oil and a little avocado adds these healthy fats
yeah, yeah,
to your
definitely.
vegetables. And so that's going to keep you, it helps satiety. That's what fat does.
Oh yeah,
So you will be fuller longer.
yeah, definitely.
which is nice.
All right. So is there anything that, because I think I've interviewed like maybe two people about energy healing. So I'm still kind of new to getting the right questions out, or even facilitator, a transformation facilitator. Is there anything that I didn't ask that I should have asked that you would like our listeners to know about energy healing or transformational facilitating?
Sure. That's a good question. So, with energy healing, I mean, partly how I think about it is I go back to physics,
Mm,
because, in terms of physics, we're basically part waves and partly standing waves. And that's basically why energy medicine works.
okay.
It's just that as my physicality here, it's just a really slowed down standing wave enough.
Mm,
Well, and then you have the whole perceptual thing. So I'm perceiving I have a body with fingers, so so I can feel it, but it starts in my head. Remember, all our perception starts in
yeah.
our head,
Yes, they
which is
do.
really makes it really kind of mind blowing if you think about it. But that's how it works. And it's so interesting how energy medicine can work online. I recently got these selenite swords, which put out a lot of, again, what you call fifth dimensional energy, which is very high vibrational energy. So I
Mhm.
was with a group of people, and we were all online. We were all in different places, and I did a light energy activation in
Mhm.
my room here, right here, online, and had them all close their eyes
Yeah,
in different places around the United States.
yeah.
And they were feeling, report back to me what they were noticing each step of the way. And they were feeling it. It's so wonderful. So, one of the cool things about energy medicine is it's non-local. And anyway, so that's a couple just fun things about energy medicine. Is first the relationship with physics. So to
Yeah.
me, that's part of why it works,
Mm,
and what, because you're impacting the field
yeah.
of we have, whether it's the physical body field, the emotional body field, the
Mhm.
mental body field. I'm thinking, therefore I have a mental body, and the
Yeah.
spiritual body field.
Yeah.
And if you impact where the areas where there are energy blocks, or like a conglomeration of stuck energy, and get it to release, or so, then it'll impact the rest of the energy bodies, including the physical body.
Mm.
Though the physical body, because it's really slowed down vibration, that can take longer to get an effect in there. But it's so
Mm.
wonderful.
Interesting. Yeah, I think a lot of people are, you have the super logical people, so they need that. They need
Mhm.
that info in order to even progress. They're like, okay, so there's some kind of science here about it.
Right,
Maybe I might test it out.
right.
So, and it's,
Yeah, and then you just have to, if you choose, go ahead and experience it and see what the experience is for you.
yeah, yeah,
Because and I hold various types of alternative and Western medicine to that. It needs to be helping you.
yeah,
You need to either experience something, or the thing where and or that
yeah,
that it helped,
yeah,
and then do it.
yeah, definitely. All right. Well, thank you so much for being on, Karen. I appreciate it. And so much, like I said, you just informed me about transformational facilitators because I didn't know anything about them. So I appreciate you being on and just telling me more about it. And I'm sure our listeners appreciate that as well.
You are so welcome. This has been so much fun. It's just fun to share this, because there's so many interesting things, that we learn in our lives, and it's fun to pass them on, or
Yeah,
let people know about it, or think about something a different way than what you've ever thought about it. That's like half the fun of life,
it is. It
learning
is.
things new.
Yeah.
Well, it's been a pleasure. Thank you so much for inviting me.
Yes, no problem. Thank you.